Welcome to the Dietitian Against Diets podcast. As you see, the background is a little bit different today as we're doing everything virtually in light of what's going on with the epidemic. I'm going to introduce you to my guest today. His name is Dr. Myles. He is an internal medicine and infectious disease specialist doctor. Great conversation. He's going to tell us a lot about some of the things when it comes to how we can have more precautions with the particular situation with the COVID-19 that's happening. So it's going to be a great podcast. Before moving forward, I want to give acknowledgement to one of my biggest partners in helping this podcast be a part of programming, and that's Midwest Dairy. Advocating for their Undeniably Dairy campaign, where they're helping the community, helping you all understand the importance of why dairy is there. So one of the biggest questions is dairy healthy? And obviously as a dietitian, I can vouch for that. But understanding when just one glass of milk, you're getting 9 essential nutrients that is going to help for your body as far as building your body, as far as building your bones, and all the important things that you're going to need just to kind of thrive in life. Some of the milk facts, I want to take a closer look at some of the nutrients that you are getting. So we know that protein is a component of drinking your milk, and it's good for your body as far as building your immunity system and building your muscles. Consider what vitamin D and what calcium and what phosphorus does. That's particularly helpful with your bones, whether it's your teeth, and just help to build them be stronger. Vitamin A is good for your skin and it's good for your eyes. And B12, we all know B12 is great for our functioning, for our neurological functioning, and also for blood formation. So in these times, when no matter if it's strawberry milk, chocolate milk, skim milk, whole fat milk, they're all still going to come with these 9 essential nutrients that your body needs. So I want to encourage you guys to continue to bring in dairy as a major part of your life and as your daily regimen. Get ready to hear a great conversation with Dr. Myles. Well, hello, everyone. This is Rashonda Thornton, the Dietitian Against Diets podcast show. I have with me today an interesting guest. His name is Dr. Myles. He's a St. Louis physician. He specializes in infectious disease, and he's an internal medicine doctor. And not only that, but he has a pretty big track record, all the accomplishments he's done over the last years. I'll briefly give a synopsis, but I know he'll do a better job at kind of detailing it a little bit. But he, not only as a physician, he also served in the U.S. Army, and he completed his research in the military HIV research program in D.C. He worked in Maryland for a while and then found his way back to St. Louis in 2013, where he started the infectious disease clinic at Mercy. So bringing it full circle, he has a clinic here, practice here in St. Louis, and he works hand in hand with his patients, and he has an interesting way in which he stands out in the way he interacts with his clients. One thing that I do admire about him in the giving timing that we have, he specializes in infectious diseases. I know that he will come with some great information for everyone on this show. I know him personally. We met on a panel last year. Was it Edwards Jones? When we were having a discussion among other healthcare professionals that came from different realms, whether it's mental health, community health, me, nutrition, and him as a physician, and how we can help the audience understand health and how to address it and what resources they have around them. So through that connection, we just kind of continue to communicate and we respect each other's practices. So I'm very delighted and grateful to have you on my show today, Dr. Myles. Welcome.
Thank you, Rashonda. I appreciate it.
Oh, no, you're so welcome. Let me know if I missed anything in there when I was giving a description of you.
No, you just made me feel like an old man, though. You did.
You have a lot, so it's very commendable.
Thank you so much. You did me justice. I appreciate that.
Oh, well, you're welcome. Well, it's a pleasure again, like I said, to have you here. And, as I'm reading through, just kind of your accomplishments, I mean, it's so much more that you've done under those layers. But I know it all comes to head as to, where you're at now. So my first question to you is, who did you just wake up saying, I just want to be a physician? Did you just grow up saying that? And if so, what brought you to be in the field the specialty that you are as a physician?
Very good question. I've been asked that question a lot as I go and talk to communities and young students who are interested in becoming physicians. And interesting enough, I've known that I wanted to be a doctor ever since I was about 10 years old, which is very unique and different. But my mother was my inspiration for wanting to become a physician. She was not a doctor. My mother had maybe a 6th grade education, but she had a religious duty, or felt that she had a religious duty, to go around in the community and help everyone that was sick or who could not come to church on Sunday. So there was one kid who was pulling at her dress tail saying, "Can I go with you? Can I do anything? What can I do?" And believe me, my mother had no nursing skills, or she certainly didn't have a medical degree or anything like that. But she allowed me to do whatever I could to help her take care of the sick and shut in, as they were called back in those days. Yeah. And so if that was just putting a cool towel on their head, sweeping their floors, making them meals to eat, anything that we could do to make them feel better, she started me doing that at about the age of about 10 years old. And from that, just reading a lot of books and finding out about a lot of people, and a lot of them were nurses, people who started the Red Cross and things like that. I was a prolific reader. I read about 20-some books a day just about as a kid, and a lot of it was associated with healthcare, and those things kind of promulgated in myself to want to become a doctor. Now, this is interesting because around that time, I was serious. I wrote to the American Medical Association in the 5th grade at 10 years old to say, what do I need to do to become a physician? I still have the letter here. I show it to my daughters. One of them wants to become a doctor, and she just shakes her head and is like, "Yes, Dad, we know you wrote the letter to the AMA when you were 10 years old," and they responded to you. Well, first finish high school and then college, and they gave me a list of prerequisites that I would need to do in order to become a physician. And I hung on to that letter. I really let that be my roadmap in terms of where I was going to go.
And then from there, after getting your medical degree, you went into the military, correct?
Yeah.
Prior to doing, or how did that,
Yeah. From high school, I graduated high school and went to Howard University in Washington, D.C., and actually I have a degree, a Bachelor of Science degree in physician assistant. So I actually was a PA for about 4 years prior to going to med school. I had an outstanding private HBCU experience. If anyone has gone to an HBCU, they'll know what I'm talking about. And I had some great teachers that really put into us that we had to be social engineers, that we had a special community and a special population that we had to be concerned about. And if the needs of that population was not being met, that we had to develop the resources to meet those needs. So they put a lot of pressure upon us at my school as a physician assistant, actually, to go into our communities to bring healthcare and medicine from the ivory tower, so to speak, down to the community level. Thank goodness for that, because certainly that's what I'm doing right now. But after working as a PA for about 4 years, and it was in lots of different things, to include corrections. I was a community PA at a community hospital at one point. I did addictions research for the National Institute of Health. And then I did the AIDS clinical trials unit at Howard University. I was a PA working there as well. And I believe that's what's more shaped my wanting to continue working with HIV and AIDS, even through medical school at University of Maryland, Baltimore, and then graduating there and doing my postgraduate training at Walter Reed Army Medical Center as an intern, a resident, and then later on as a fellow. I think I was there for 9 years or more, trying to
have been there for a while.
Yes, I was there for 9 years or more, just trying to hone my craft at being the best physician that I could be, knowing that I was going to have to go back to my community and be this social engineer if possible, in reference to not everything that we learned was geared towards the minority population, the HIV/AIDS population, the gay, lesbian population, all these little small populations that may get thrown to a side. And they kind of expected us to be able to talk to all those populations and take the knowledge and training that we had to make sure that we were meeting the needs of all those other populations as well.
So essentially adapting
exactly
to your community. And so like even with that, is that, what you reflect in your practice now, in regards to your population?
Absolutely. So right now I'm in South St. Louis City. I'm in the Watson Medical Building, and I've been there since July of 2018. Coming to St. Louis, I started out at a major hospital here, a Mercy Hospital, and I actually started their infectious disease clinic, was there for several years and went over to St. Luke's Hospital. But now I'm doing it on my own. I'm an internal medicine doctor doing primary care. So I take care of people with high blood pressure, diabetes, asthma, all of the normal things. I do exams for FMLA and disability and things like that. That's about 75% of my practice. The other 25% is specialty care, mainly towards infectious diseases, where I get the opportunity to actually take care of HIV positive patients who want PrEP or pre-exposure prophylaxis, and they don't want to get HIV, but they're high risk. So I offer that. I take care of patients who may have been exposed to tuberculosis, STDs, you name it. As an infectious disease trained specialist, I get to also do those types of things for about 25% of the practice that I'm seeing there at Myles Healthcare.
Okay, so you're basically able to do, collaborate some of your specialties with your foundation of practice. You may to provide those services for those particular patients. I mean, even having that specialty, do you find, there's this large health disparity amongst even, I guess, the population that you serve that may not have this type of care or recognize that this care is available? And if so, like, what are ways in which you've been able to kind of get your services out into those communities to where they recognize that this is accessible?
Well, what you're talking about is geared towards healthcare disparities and talking about social determinants and things like that. And I've been doing that throughout my whole practice, where I want to make sure I meet those needs of those other populations. I recently spoke at Washington University to a group of city developers, and in terms of when you are mapping out the city, should you take healthcare into consideration, and if so, how does that differ? And what I was able to share with them is social determinants of health. We have lots of people that their health is determined by the zip code in which they live. So now I'm in South St. Louis City versus I was in the Creve Coeur area, and I go to church and do a lot of things in North County. So if you can imagine the patient population that I have, and I have a nice sized patient population, some people are traveling from 100 miles out to come to see me there in St. Louis. It's all very different. You have people who come in who know exactly what's going on with them. They bring me something off of research that they've done off of the computer, and they're challenging me on the newest things that are out and asking me, why don't I have it there at Myles Healthcare? On the other spectrum, I have some people who I basically say respect the white lab coat. They come in, they looked at the floor, I ask questions, they answer questions, and it's whatever the doctor says is what I'm going to do. A lot of times in those situations, these people don't know their blood pressures. They don't know their HIV status. They don't know what is good for them in terms of nutrition and things like that. And so that requires a lot more time and energy and education to make them more informed patients who can become part of a team. I'm a former military guy, so I look at this as a war against illness and sickness, and I want you to be the best soldier that you can be to fight this war off. So I'm not the person that's just going to tell you what to do and then wait 3 months to see if you've done it or not. I truly want someone to be a part of a team and you're
Mm-hmm.
bringing things to me, and you're challenging me, and you're telling me how, or asking me how I can help you be as healthy as you can be. And so with that
That's
population that I have, it's very, very
mhm.
varied.
Well, you know what? That's one of the things that stood out to me when we were part of that panel, and how you encourage patients to come with questions, ask questions. Don't just follow whatever the doctor says. It's not saying don't listen to what he's saying, but perhaps you understand why he's saying these things, or even just not let him just giving you some over, surface answer, but be able to give you some more depth. Because again, do you just want a physician that just going to give you a prescription only, or someone that's going to help you to understand what can you do with in light of having this medication if needed, and how can you create preventive ways to where this being informed, being educated, understanding preventive measures to help that person flourish through life, and be give them autonomy, give them accountability, where they feel the confidence to improve their own health.
Absolutely. That makes the best patient. If you come to me with that sense of thinking about what's going to happen with that visit, and you're bringing things with you and you're asking great questions, we do understand by the literature that with having an internal medicine doctor on your team, that the average life expectancy is 85 plus. And let me tell you, if you don't have a good internist on your
Mm.
team, or if you're not going for your preventive health, some of the things that you just mentioned, breast cancer screening, mammography, high blood pressure checks, and things like that, that life expectancy is very low. If you begin to look at zip codes where these people are living, the life expectancy within a 5 mile radius can be much lower for someone who's living in St. Louis City versus someone who's living in St. Louis County. I like to talk about those things with my patient in terms of what is it about St. Louis County? Why? What's the difference? And we begin to talk about housing issues, talk about food and nutrition issues, and other things like that. There may be
Yeah.
opportunities and resources in the county that are not in the city, and we have to bridge that gap. We have to first inform you about it, and then allow you to and help you make good decisions about the things that you're eating, where you're living, and other environmental behavior type things. So when
Yeah.
you look at healthcare, it's about 20% genetics. No matter what I do for you, if you got that bad gene that's going to give you high cholesterol, and that bad gene that's going to give you high blood pressure, there's really nothing I can do to change that. I can help manage that. I can help mitigate some things with that. And then there's about maybe 20% that is health, that things that we can do. And then there's 60% that's social behavior type things. What are you eating? Where are you living? What are you getting your sleep? Are you drinking water? I mean, all these other things. Are you managing your stress? Because living here in St. Louis,
Mm-hmm.
and especially right now with everything that we got going on, this can be a detriment to your health. So 60% of looking at good outcomes, which is what we want to do, is going to be based on social behavior type things.
And you know what? I'm so glad that you just kind of put it in numbers to show the weight of
Yes.
what components can contribute to better health, because the social, it's a holistic approach. It's your environment, it's your culture, it's not just the education, so many components to it, but it's also the heavier driver
Yes.
towards your health.
Yes.
And to understanding like that needs to be addressed, and how can a person begin to address that, is what's going to um, empower them to make those changes within that dynamic to overall improve their health. So I mean, again, that's just like I want to call it a nugget that people have not looked at it in those pockets, and recognize the degree at which one contributes: the genetic component, your health component, and then just what are your surroundings. And I think even as a physician, that's not something common that comes out of the mouth of a physician. Now,
It is.
I want for some people that are watching, or maybe still they're learning too, could you just really quickly distinguish between an internal medicine doctor and a physician, a primary care physician?
Absolutely. We got a call yesterday, I believe it was, in the office, someone who was looking for a general practitioner. There's no such thing as a general practitioner anymore. They went away
Yes.
by the wayside years ago. And believe me, you don't
Mm-hmm.
want a general practitioner because basically that means that they did some training in a little bit of a lot of different places, but they have no expertise in anything. And in today's world, we're all specialized. So we have a lot of training in certain things that we know are going to make a difference. So as an internal medicine doctor, I went through an additional 3 years of training past going to 4 years of medical school. In that 3 years of training, I managed and took care of the sickest of the sickest patients. These are patients who were admitted to the hospital for acute care. So intensive care
Okay.
units, critical care units, coronary care units. And these patients are typically 18 years old and older. It used to stop at 65, and then there's a specialty called geriatrics, but there's not a lot of geriatricians out there, so we still have to take care of those patients as well. And our training afforded us the opportunity to do that. We spent every year we spent about 8 months inside the hospital, which I think where that internist came from, inside the hospital taking care of the sickest patients. Now, in addition to that, I did an additional 3 years of training in infectious diseases where I could actually focus and narrow my training down to treating people with infections, whether they be viral infections, bacterial infections, fungal infections, parasitic infections, and things like that. So I was able
Okay.
to do a lot of diagnosing and treatment and management of things like HIV and syphilis and tuberculosis and gonorrhea as well. But when you're out
Okay.
there and you're looking for your primary care doctor, please take the time to investigate what type of doctor he is. And you want to make sure that he's somebody who knows what he's talking about and understands the research process in reference to looking at studies and things like that to say, has this been tried and true and tested? And am I going to be doing my patient a service or a disservice by making a recommendation for a simple thing? I'm not sure if you were aware, but recently the recommendation came out for azithromycin and chloroquine for coronavirus, and someone
Yes.
did not read it correctly and actually took the wrong type of chloroquine, the chloroquine that we use to give fish to treat parasitic infection, and now that person is dead. He passed away. So it does
Oh
really
my.
matter that your doctor understands how to look at a study and not just rubber stamp everything like, yeah, that's good for you. I get a lot of patients asking me about St. John's warts. I get a lot of patients asking me about multivitamins, A, D, E, and K. And I mean, I can list the name of things. Some things I can definitely say, you know what? I've read the literature, and there's a randomized controlled trial that says that this is either good for you or not good for you. There are other times when I have to say, you know what? There's no clinical trials on this. I cannot
So
give
you
you an
can.
opinion about this
Mm-hmm.
because it's just not there. And
Yes.
I'm willing to do that. I'm not going to rubber stamp anything that somebody brings to me. I'm going to take the time to actually go out there and seek guidance from any clinical trials. But if they're not there, I'm okay with saying that. You know what? We don't
Yes.
know.
And that speaks a lot just on your integrity, especially as a physician, because
Yes.
being a physician, you are the know all in all. And we as
Yes.
patients, as population, depend on your knowledge and, your ability to translate that into your practice and how, what treatments you prescribe. And so I think that's really great that you are really big on making sure that, you're going to give the information that's evidence based and that's current. And if there isn't any out there, that's you're gonna be transparent in having a conversation with those patients. Speaking of just the infectious diseases and the viruses and things that is kind of swarming around us right now, in respects to the COVID-19 and just how it had just massively just kind of taken over the last couple of weeks. What's you being very knowledgeable in this area, like what is your take on the volatility of it, and like, have you seen anything? What would you compare this to, or is there anything to compare this to?
Uh, Most people probably would compare it to the Spanish flu. epidemic. So, we do have something to kind of compare it to. But this is like nothing. There's nothing else that we know of that has hit us like this at this time. It's really stretching our healthcare system and healthcare resources to a tremendous amount. Right before this podcast, I was on a webinar with the Surgeon General of the United States, with a group called the National Medical Association. He was updating us in terms of the things that are going on right now. I can tell you he's been saying the same thing, is to brace yourselves because we may not have seen the worst of it yet. Here in the United States, we are blessed to do a lot of testing that other countries could not do. We're doing it very quickly, so we're getting more tests done. And so our numbers are probably going to go up for quite a while before it begins to slow down for that particular reason. So we want to make sure that people are doing what they need to do in terms of hand washing and social distancing and things like that, everything that they've put out thus far. If you're symptomatic at all with fevers and cough and shortness of breath, make sure you're calling your primary care doctor to figure out, is this something that needs to be evaluated, and if it needs to be tested for coronavirus. Right now, we have a shortage of testing. So, of course, testing is going to be done on the sickest patients that are in the hospital. Mm-hmm. But your primary care doctor should have access to get you a test if he feels in his clinical judgment that you may be infected with coronavirus.
Those are great instructions. And one of the things that you mentioned that I think is so important is understanding what to expect hypothetically moving forward. There's going to be a spike before it starts, and I don't know where we're at in relevance to our incline, but understanding that we're on the way up the roller coaster. Yeah, yes. And you said a while. I definitely don't. Yes, you're testing more, which means it's going to create more cases, but that's what we need to be able to kind of be able to focus in knowing, what's happening in real time,
Absolutely. As an epidemiologist, you want to know where everything is because you want to be able to give the resources appropriately. Whereas New York City is a hot spot right now, that's going to change. And we want to be able to get the ventilators, get the everything that we can do, the resources, the people, the nurses, the gowns, the gloves, all those things need to be pre-stocked and placed at different places. So that is the purpose of this testing. It will give us an idea of where the hot spots are going to be.
Yeah. So for the areas that, do you feel like, because right now New York is it is the hot spot, and there are a few cities, New Jersey, that are coming right behind it. When you see that, you think, okay, they're in the midst of it, but you're not thinking about, okay, that could easily transition over, to where I live, so outside of the social distancing and continue with the hand sanitation and the precautions that we've generally been taking, what are some other things that you would recommend for people that's in areas that may not be at a higher rate, but definitely have the potential like any other area?
So in addition to doing everything that the Surgeon General has been saying every day about hand washing and social distancing, just remember some good old facts that this is a virus. So, we don't have a cure for viruses. That the way this virus is spread is through person to person, and that usually means within 6 feet. So the best thing you can do is stay away, stay home, or stay within 6 feet if you have to be somewhere. And here in Missouri, we're saying no more than 10 people at any one time. We're practicing social distancing just today with you're at one place and I'm in the other place. So we're a great example of what we're talking about. When you get past that, protect yourself and protect your family by staying informed in terms of what's going on. The best resource that I've been using is the CDC's website. If you go to cdc.gov, they have a whole website there for coronavirus, and it does break it down to if you're a business owner, if you're own a church, or if you're a church person, if you're a person that works in an office, or if you're a person that works in a hospital. So they do try to break it down to the things that are meaningful to you. The second thing is prepare for possible illness. If you're at home and we're asking you to shelter in place, There may be an elder person at the house with you, a grandmother, grandfather, or auntie, or whatever. Look out for that person. Make sure that person has at least 2 weeks of their medications. Make sure you have enough food and water for at least 2 weeks so that you do not have to leave the house if unnecessary. Understand that somebody may get sick at home, and so you may have to have a sick room where if somebody's not feeling that great, if they begin to show signs of fevers or something like that, you may want to isolate those people in the home in a room separate from everybody else so that everybody else doesn't come down with something at the same time. Don't forget about the hand washing. Avoid touching your eyes, your nose, your mouth. Stay home when you're sick. Don't go to work, even though there may be pressures for you to do that. With the acts that the president is passing, you should be okay. We would much rather you stay home than to try to be a violent soldier or something, come out when you're sick with a fever, shortness of breath, or some of the other things. Watch for symptoms. If you begin to have trouble breathing, chest pressure, high fevers, and things like that, you may need to call 911 and utilize those sources. The other place would be to call your primary care doctor to see if he can get you in to get evaluated. As a primary care doctor, we are doing that in my office. We are practicing social distancing at the office. There's no more than 3 people in the exam room, in the lobby or the waiting room at any one time. We're moving patients directly into their own exam rooms. We're only using the equipment in that exam room on that patient. And then as soon as the patients are leaving, everything is disinfected and clean for that particular person. Don't be surprised if your doctor gives you a facial mask to wear if you're presenting with symptoms such as fever, sneezing, coughing, and things like that. I would tell you, even at home, if you're coughing or sneezing, remember to cough or sneeze into tissue and then get rid of that tissue into trash can as soon as possible. Don't let things sit on tabletops and things like that.
Wow, it's great information. Those are the thoughts. Those are some precautions that I haven't even thought about, and I think those are great for people to hear because you hear all the major steps, but you never thought about how to be prepared. How to set up your home if someone in your family has this. How to think ahead as far as having a medication and having things available. Sneezing inside of it, you think it's common sense, but sneezing inside, being more aware and intentional, to keep
Absolutely.
things as tightly as possible. So those are great examples. And I think I appreciate that. I know the viewers and listeners will as well. Now, the last thing I just want to kind of bring into the fold of this is, I know communities that have compromised immune systems are the ones that are going to be susceptible to a higher, maybe more towards a higher mortality with this. In light of just that population, but just maybe people that may not have any of those type of predispositions, health related predispositions. How would you recommend the general population to find ways to enhance their own immunity system, just to if they do encounter this, their body can fend it off as best as possible?
I think when we look at our own body's immune system, it's the stuff that we are told all the times about getting enough sleep at nighttime, at least 6 hours of sleep every night, drinking our fluids as much as possible. And although it may be a little hard right now, but exercise. If you can keep that 40 minutes, 4 days a week of aerobic exercise going, that's going to drive a lot of catecholamines and endorphins inside of you that may be helpful to you at this time. I can tell you right now in my practice, and I believe across the board, we are seeing a lot more people who are not dealing with this situation that well. They're very stressed out. Just the other day, I had a nurse at one of our major hospitals who came in to see us, and it was obvious by what she was saying to me that she was depressed and having a very hard time dealing with what she was being asked to do as an intensive care unit nurse. 12-hour shifts, taking care of some of the sickest people right now, to the point where she did not want to go to work the next day. She wanted to give up her whole career of nursing based on what she had been through for these past couple of days. This is no joke. The people who are on the front line are seeing some really tough things right now, and we're asking them to stay professional and do their jobs, even when we are not maybe giving them all of the equipment that they need to protect themselves with at sometimes. So I would tell you, be very careful about stress and how you're going to deal and cope with it. Know that we can't control what life brings us. However, we can control how we respond to it. And so we want to make sure we know that this environment that we're in right now is not going to last always. As you talked about before, there is a curve. And at one point, that curve will bend and we will plateau and we will go down. So to keep things in focus, make sure you're getting good information. But sometimes it may be helpful just to turn that television off. Give yourself a break. Today is Saturday.
If it's going to increase your stress levels.
Yes. Today is Saturday, so I'm going to take a break from coronavirus today, and I'm not going to watch anything related to coronavirus today. Today would be the day to watch Madam C.J. Walker or something on Netflix.
Did you get paid for that
one? No, they did not pay me to say that. But I want my patients to get some kind of joy through all of this. We totally understand that we are in this together and we're staying home together. But we do have to find ways to relieve stress, whether that's just taking a mental break, breathing exercises, whatever you may find helpful to you to do. You need to do that because stress is going to be the worst thing on your immune system at this time right now.
Yeah. And I totally agree with you. And I'm just going to throw in that plug about, looking at our body internally and the inner workings of it and just making sure your body can just be optimized. It's a couple of ways your body's going to be optimized by moving it, your mental stress that connects to everything. But what are you putting in it? I definitely going to grab a salad tomorrow. It's not going to give you the biggest immunity towards this disease, but you're starting to create those building blocks to where your body, you're giving your body those nutrients that it needs to do the small stuff that turns into the big stuff when it comes to your immune system. So obviously as a physician, you definitely are an advocate for this, but how are we, what are we doing every day that we can do on our own to improve our health? And that is making sure in spite of what's going on, we still have accessibility to grocery stores. They have delivery services. So we have the ability to just make sure that we're giving our body the healthy nutrients that it needs so it can have everything. We can do the best we can on our end, to fend off this disease or even the effects of it, So I totally agree with you on that. So as we're wrapping up, I do want to let you know that you have come with some profound information. This is great for everyone to hear because we're reading it, we're watching on the news, but we just really don't have like the voice that just kind of can bring in direct information from what they practice on a regular basis. So it's great to have this conversation. Now that what I want to do is make sure that anyone that has any more questions or they really liked the way that you are handling this and your perspective, I want to make sure they know how to reach you, where you're at. So if you don't mind, definitely let us know where your address, where you're at in St. Louis, as well as other ways we can find you, your website, any ways that people can connect and find you.
I think the easiest way is to call our office, and our telephone number is 314-833-4001. And we are located in the Watson Medical Building at 3915 Watson Road in St. Louis, Missouri. And we're actually in South St. Louis City or in the Lindenwood community area. A lot of people know where Ted Drews is, and we're right up the street from Ted Drews. My email, and we do have a secure email if patients want to just send us an email and say, hey, can I get an appointment? Or hey, can you answer this question or so? It's office@myleshealthcare.com. And Myles is spelled Myles. Healthcare is HEALTHCARE.com. We do have a website, and the website is my name as well, myleshealthcare.com. We have a Facebook page. The Facebook page is my formal company name, Dr. Otha, Myles, and Associates. So check us out on Facebook as well. I got my wife helping me out with that, so she will appreciate it if you like the page or something like that.
Oh, definitely. Well, when we get ready to post this, I will make sure all that information is on there because I want people to know you're welcome. I want people to know there are resources out there that could at least inform them. There's a service out there that they can find is a good fit for them. Just knowing, that you have all of it's education in so many areas of medicine. I'm sure there are a lot of people out there that has no idea that this is out, that you are physicians like you exist. And so I really hope that they are able to see and find you and you're able to help them as you're moving forward with the community. So, Dr. Myles, I am glad you took your Saturday afternoon to have this conversation. I do appreciate you just giving your knowledge and just giving your passion in light of what's going on today. And I just want to say thank you.
Well, thank you so much for the invitation, Rashonda. And we are praying that you will come by Myles Healthcare and work with some of our patients and have some discussions with them about healthier nutrition.
Well, yes, I'm definitely on board for that one. So,
Yes.
for sure, we're gonna compete a team up in this thing. We're on the
Exactly.
same line for to help the community. So
Exactly.
everyone, this is Rashonda Thornton, the Dietitian Against Diets with Dr. Myles here. Again, these conversations like this is needed. Let's talk about health and not just our physical health, but our mental health and our just emotional health, especially during these times. So continue to watch these episodes, continue to learn, and continue to change your perspective and the way you interact with your health and your nutrition. Talk to you guys soon. Bye-bye. Okay, so I can hope you guys were taking notes on that conversation. I'm glad that it was on record so I can go back and just write some of those things down. Valuable information that I haven't even thought about given the times. As I'm closing out, I wanted to recognize one of my partners, Precision Massage. They're actually here in St. Louis. Right now, I know that we're all cooped up in the house and we're not moving, so our body's probably getting tight, and I'm sure that we would love to have the relief of just getting a good massage. Well, let me kind of distinguish what this company is, because it's not just a massage company. It provides targeted pain relief using neuromuscular therapy. And that's the most efficient and effective way for pain solutions. This actually has become one of the essential healthcare services that's happening right now, because if you can't get to your physical therapist, Beth Mattis, who is the owner, she actually was a licensed physical therapist, and she went on to get certified in neuromuscular therapy as well as massage therapy. So she's kind of that gateway and that gap in between. So she's offering gift cards right now. She's taking appointments very maybe 4 or 5 a day, because definitely want to be respectable of what's going on, but know that people need those type of services as in regards to these times. So if you need emergency attention or you can't get to your physical therapist, reach out to Precision Massage and set an appointment with Beth. Go to their website at precision-massage.com and you can set up an appointment and learn more about their company. Another company that's around that it definitely is a good time to, when it comes to your nutrition and your health, to consider is Banner Road Baking Company. So Banner Road Baking Company has been coined as the world's best granola. And what makes this the best? Well, first of all the ingredients are are organic. There's no artificial flavors in their granolas, and everything is natural. They also collaborate with other companies and industries that in surrounding St. Louis area to gather some of their components for the ingredients. So they're big on collaboration with other companies to continue to spread nutritious eating. They're also big about sustainability. They're tin cans, if you haven't seen them yet. They're all recyclable and decompostable, to where you can you don't have to worry about them contributing to I guess our wastage that we have in the U.S. And one of the things is that they come in two different sizes. She has a 2 ounce and a 4 ounce. 2 ounce you can throw it in your backpack in your purse as a snack, or 4 ounces and larger. No, 11 ounces. You can use it as a gift or have it stacked up in your home for when you're bringing in your snacks. Right now, they are offering free delivery for any purchase over $25. And if you put in code, all capital words, stay strong, you will get free delivery services all the way up until April 15th. Go to their website at bannerroad.com, see the varieties of their unique granolas. Follow them on Instagram at Banner Road, or you can follow them on Facebook as well. Banner Road, all about bringing in nutritious, healthy, whole ingredients to your table. Thank you guys. I hope you guys enjoyed the show, and I will see you next time.